Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another episode of the Lunch and Learn with Dr. Barry. I'm your host, Dr. Barry, PR favorite, board certified internist, founder of drbarrypr.com, as well as the CEO of PR Medical Consulting, helping you empower yourself with better health with the number one podcast for patient advocacy, affirmation, and education. This week we have Dr. Crystal Maxwell, who's a family medicine physician, graduated from the University of Tennessee, family medicine residency program, as well as the College of Medicine as well. And this week we bring her on to discuss her contribution to the anthology, The Chronicles of Women in White Coats, Volume 2. And she's actually the first in a series of interviews we're going to be doing based off the newest anthology of the Chronicles of Women in White Coats. And I've had the pleasure to interview a few members in the past. If you guys may remember Dr. Amber, as well as Dr. Kimberly on past episodes, I will put their links in the show notes. I've got the opportunity to reach out to talk to a few more new physician authors, which, you know, I love speaking to physicians who are doing stuff that, that is outside of the typical norm. So Dr. Crystal Maxwell gives an amazing interview and talks about a lot of her motivation to help teach and educate her community and why she's such an amazing leader, right? Again, her CV really speaks for itself when I say that she's an amazing leader, amazing thought provoker, and she's someone that you're definitely going to want to hear from. So like always, remember, take notes, share the podcast with 10 of your friends, subscribe to the podcast, and have a blessed day. This podcast is sponsored by the Lunch and Learn Community Merchandise Store, living out the motto, empower yourself for better health. At the store, you can get your favorite t-shirts, coffee mugs, even wristbands, and more. For a limited time, you can get 10% off your next purchase using the coupon code EMPOWER10. That's EMPOWER10, EMPOWER10. Just go to shop.drbarrypr.com to pick up your purchase and get 10% off today. And remember, 50% of your purchases will be donated to the 5-Star Scholarship Foundation, a nonprofit organization for high school students. All right, Lunch and Learn community, just heard an amazing introduction. And today we're going to be talking with a person who is very multifaceted, and I'm very interested to kind of get, deep into, kind of what she does. Entrepreneur, family medicine physician, also an author, right? Dr. Maxwell, first of all, thank you for hopping onto the Lunch and Learn community and Lunch and Learn podcasts. And I know you got a lot of stuff for them to kind of, take away from this episode, and I'm just excited, for you being here.
Thank you so much for having me.
So now again, is it, because my doctors are typically different. Now, is it Dr. Maxwell, Dr. Crystal? How are you known out into the world out here?
Dr. Maxwell.
Dr. Maxwell, perfect. So tell us a little bit. I got a lot of people who, they listen to the introduction, but they like to fast forward. They get right to this main portion of the episode. Tell us a little bit about yourself, who you are, and and like I said, we're gonna get into your business today, but just a little bit of introduction, just in case someone like fast forward and pass right through the introduction.
Okay, wonderful. I'm Dr. Crystal Maxwell. I'm a family medicine physician, originally born in Mississippi, born and raised, and I still have a lot of family there as well, and currently living in South Carolina. I'm a chief medical officer at a community health center. I've been there for 10 years, been the chief medical officer for 8 years. And I am a wife and mom, most importantly. Those bring me my greatest joys of being able to be a part of my husband's life, who's also in medicine, and see my growing daughter, who's into almost everything from dance to soccer to swim. And so trying to stay on top of those things and keep up with her busy schedule. It has been, having to multitask has been a learning curve, new learning curve. You get a lot of multitasking in medical school, but it becomes much different when you become a wife and a mom. So those are my greatest joys, along with working with community organizations with my sorority and serving as healthcare director at my church.
All right. So, first of all, what sorority? What sorority are you part of?
Alpha Kappa Alpha Sorority
Oh, I love it.
Incorporated.
Love to see it. Love to see it. Um, so I always get every time I get my doctors on the show, I like to, because a lot of my audience are either patients or kind of getting into the healthcare field themselves, or just trying to be more health conscious. And I always tell them that not everyone's story is the same as far as how they got here, right? Typically, they typically see the end result, right? Like they see Dr. Maxwell, all these amazing things, right? But they don't necessarily see what it took to get to the point before Dr. Maxwell became Dr. Maxwell. Can you talk a little bit again, like I said, about just kind of about your path into medicine, why medicine, some hurdles that you may have had to come across, across your way?
Absolutely. So my path to medicine, I was always into science as a child. Science was always my favorite thing. From marine biology, thought I wanted to be a marine biologist at one point, and thought I wanted to be an astronomist at one point. But my freshman year of high school, my grandfather got diagnosed with advanced stage prostate cancer. And going in and out of the hospital, seeing the nurses, the doctors, and all the machines, I was just absolutely fascinated with everything that they were doing. Coming home, having conversations with, or overhearing conversations, not me being a part of it, but overhearing conversations with my grandmother, my mom, and them talking about his health care. It was just very interesting to me that they still had a lot of questions, even though we had just left the hospital, just left doctor's office. It was like, we just left there. Why are y'all still have questions about what's going on? And so I knew I wanted to be on the physician side of that story. And to try to help bridge that gap in making sure that patients and their families understood what I was telling them from their medical care, and that I knew what was going on. And that when my family had issues, that I could be that one to say, well, let's talk about it. This is what's going on. So that really made me decide I really wanted to do medicine. And that became my commitment after that, doing science programs every summer when I was in high school. And then when I went to college, enrolling as a pre-med, and then doing science medicine summer camps to expose myself to physicians and began getting that training.
And what I love is, especially for those who typically go into the ambulatory community medicine, a lot of that story seems to always ring true, where our family members are going to these doctors' offices, going they're doing what they're supposed to do. But when you ask them, like, oh, hey, how was the visit? Because my mom still to this day, like still now, right? Like, oh, how was the visit? What did they say? I don't really know. And I'm like, well, how did you, like, how? And I always ask, like, how did you leave there not necessarily knowing, what you were supposed to do? And, I used to think like, oh, people don't do that. Like, no, they get all their questions done. And I was like generally shocked the amount of people that, go to the doctor's office and have no clue what they're supposed to do next. And then on the physician side, where we call those people, oh, they're just not compliant, they don't follow directions. No, they never even got a grasp of the initial directions in the first place to actually follow. I love that. I love that analogy because it rings so true, and it is so common, with the patient, especially. And again, I experienced it pretty early too, kind of, seeing, my mom and dad and like just in the healthcare system, but not necessarily in the healthcare system. Like they had one foot in and kind of one foot out, kind of wading through the waters. So yeah, I love it. Absolutely love that aspect. And you were actually introduced not only in medicine, especially through your grandfather, but also like yourself, right? Like you got a kind of an early introduction to the healthcare system, because I know a lot of people, especially the mid 25 to 35 range, they typically only go into the doctors when the mom takes them and everything else, and they're not necessarily for any other real reason, for just like their wellness checkups. But you were actually introduced unfortunately very early to the healthcare system. Can you talk a little bit about that and that path, which was very interesting?
At the tender age of 30, I found myself being in congestive heart failure, severe congestive heart failure at that. My ejection fraction was less than 15%. When I went, I just thought I probably had a pulmonary embolism. I had a PE. I'm 30. I'm on birth control. I was on a recent flight. At that time, I had gone to fly to a friend's baby shower for the weekend. And so, I had a 6-month-old daughter. So, I'm thinking, obviously I got a blood clot. So this is going to change my life. I got a blood clot because I'm short of breath and I can't breathe. Well, that was not the case. It was heart failure. Oh, wow.
Wow.
Not
And
something that you
lunch
think
and
at
lunch and
30.
learn community. I want to kind of give you an idea. When she says her ejection fraction was 15%, the risk of sudden death, the risk of, abnormal rhythm that could, really take us at it, is extremely high. That's when we start talking about defibrillator. So I don't want us to breeze through that 15% because that is a lot. I mean, that is very severe.
Exactly. So, normal ejection fraction is above 50%. And so you're talking about being down to 15%. And so I had to wear an external defibrillator after I got out of the hospital. Of course, I was on every heart medicine that there was. And I did not necessarily have a bad diet. I was not overweight. I was not obese at the time either. I was thin. I was exercising. So I wasn't necessarily even that typical case. But I still had to tweak some things, of course, with being a lot more serious with reading labels and how much salt is in food, making sure that I wore the life vest. And I will tell you, for any patient that has to wear one, it is not fun. So that has been a learning experience because I have had patients since I have gone through that have had to wear life vests, and from my personal experience can tell them tips of how to make it more comfortable, how to deal with the itching, how to deal with taking a shower. All things that you don't think about necessarily from the doctor's standpoint when you tell someone, well, this is what you need to do. Well, how do you apply it and make it real when I have to do this all day, every day, 24/7. So I have a different perspective for that, and a different way that I can educate patients for them and supporting them in making that transition. So yes, that was a very, very scary time. Thankfully, I have recovered and have a normal functioning heart, but it was a journey. It was a little over 6 months before I recovered. So it was definitely a scary journey that took me to, they were discussing actually doing the surgical procedure for a defibrillator because it was taking a while before it was getting up at a safer point. But my cardiologist just had me modify my activities for a while. And as we began to see my heart pumping better, he said we can continue to watch, and it did recover. And so I didn't have to have that surgical procedure. He knew that I love to fly. I love to go on vacation. And so, he talked to me about, of course, that would change how going through the airport, having to have the defibrillator, that would change all of those kind of scenarios. So thinking about the real life aspects of what the impact of what someone is prescribing or telling them to do really opened my eyes up from going through that, of me trying to make sure I'm being more sensitive when I'm talking to patient about those lifestyle things that they will have to change and what's different.
And can you talk to Lunch and Learn community a couple of things? One, what is a life vest, right? And then two, how do you take that news as a patient, right? Because obviously a lot of times it's sometimes very difficult for us to separate the physician in us and the patient in us. When someone's telling you your ejection fraction is 15%, how does you, the patient, say what? And just talk to just to give a little brief of what a life vest is. So
Okay. So a life vest is an external defibrillator. So you have it's made up and strapped on like a vest, and it will defibrillate. It's the defibrillator that will basically shock your heart, and it's located on the outside of your body instead of having the surgical procedure where they put it on the inside. And so you wear it as a vest so that if your heart goes out of rhythm or stops, it will shock you.
And this is something you had to wear all the time? This is all day? Wow.
all day. I take it off when I shower. I shower quickly. When I did shower, I did let my husband know that I was about to shower, so that if I were in there too long, he would, know to come and check on me.
Okay.
But all day. Yes. Yes. So yes, being on that patient side, it was scary. And unfortunately, I did not have the best way that I was told that it happened. When I was in the hospital, the doctor side of me knew what medications the nurse was bringing to me. I was being brought a beta blocker. I was being brought an ACE inhibitor, beta blocker, Coreg, carvedilol. I was brought lisinopril. And I was like, well, I know my blood pressure's up a little bit, but why am I being brought these medicines specifically?
Wow.
And the nurse said she couldn't tell me. She said a doctor had to talk to me about my medical treatment and the diagnosis. And I said, well, can I talk to him? Well, it was a Sunday evening. And she said that the doctor was not coming by till tomorrow. And I said, well, somebody needs to talk to me, because I'm not going to go all night until tomorrow not knowing what a diagnosis is when clearly y'all have one. And so that doctor refused to set up any type of way of talking to me. So I fired him. And we got a new cardiology group to come in, and he called me on the phone, and his words were, so you're the new onset heart failure. And I said, what? Excuse me? I'm what? He said, you have heart failure. And I said, well, nobody's told me. And the doctor side of me was able to think through that they gave me a whole liter of fluid because I had gotten a contrasted CT to look for the blood clot in my lungs. And I said, well, they've given me a liter of fluid. I have not gotten Lasix yet. I had not gotten a fluid pill. So they had given me the first two medicines for the heart failure, but not the fluid pill. And he was like, you've been there how long? And I said, well, yeah, I've been on the floor and I've not gotten Lasix, but I've gotten a liter of fluid. And so immediately he went ahead, ordered the Lasix. And so unfortunately, it just was not a very good transitional period for me as a patient. And it's very scary if I had not had that knowledge with having the fluid I already had, plus the extra given, what would have happened that next 12 hours had I waited for the cardiologist the next day.
Wow.
So that was,
and you're a physician
and I'm a physician.
Experience. So wow. Okay. And the reason why that's so sad is because again, that scenario happens to a lot of people who don't have the knowledge that you have, and consequences occur. So thankfully, you at least knew what you knew, and you were able to kind of direct your care to make sure that you were taken care of. Because that, again, gotta take care of yourself, especially if it doesn't seem like those who are in charge of taking care of you are doing it. So, wow. Okay. Very.
So the next day I got my ultrasound, I got the echocardiogram, and because again, a physician, I know too much. Looking at the readings, I saw the 15% on the machine.
That is funny.
So, again, my heart sank when I realized how severe this was, because not only was it heart failure, but it was, I'm in the severe stage of this, and so, just being the patient was. It's scary thinking of me on this side and, knowing all of the possible worst case scenarios as the patient, intensifies that. And so, you don't want to always have to pull that doctor card being the patient, because I really wanted to be the patient. But unfortunately, things happen where I had to demonstrate my knowledge and make sure that I advocated for myself.
It's so funny. Every time we go to a doctor's office, like I'll be trying to be very low key with it, and my wife be like, and he's a doctor, just so we're aware of what's going on. He's a doctor, right? So don't you give it to him directly, straight, so we know. And again, unfortunately, right, people do treat you differently, right, when they know you're a physician, which again, it's a sad state from a healthcare standpoint. But okay. So fortunately for us, 6 months later, we were able to get over that hump. And, as you look back, especially at that journey in that past 6 months, how were you able to kind of, manifest the feelings and all of the practices and the teachings, everything you did, and say, all right, this is how I need to kind of move forward, especially not only for myself, but more importantly for the patients I take care of?
Yeah. So I have a hard time sitting down and stopping. So I was actually at work in less than a week of being discharged from the hospital. I was the only physician at my rural clinic in South Carolina. And so I knew my patients were waiting for me. It's hard to find a physician or a nurse practitioner to come and fill in. So, while I'm trying to recoup at home, my mind is still, I've got patients needing refills on medicines. And, what if somebody's going through what I'm going through, and are they going to be a misdiagnosis? And, all of these things that I'm trying to balance of making sure it works. So, I was ready to get back to being normal and not necessarily thinking about that I have heart failure. So can I go be a doctor and not think about that I have to do these things was one thing. I wanted to feel normal. I wanted to be the doctor, not on the patient side. So can I just go to work and see patients? And it was a struggle. I could not walk from all of my patient rooms normally as I did. I had to sit and take breaks. I had to space out sometimes my appointments and let them know, okay, I'm just going to need a few minutes. So that was different. That was different. Even when I was pregnant with my daughter, I got through that pregnancy pretty easily. And I worked up until, the week before. And so, it was different for me having to say, okay, I can't do my usual. And so I mentally had to find a peace within myself and pray and stop and say, Crystal, it's okay that you can't do what you could do, but let's think about. And so I had to find a peace point for myself in that, and saying that it is okay that I'm not perfect and that I'm not where I used to be, but I have to be thankful for where I am. And so that took some transitioning, undoing, remembering to take medications. I had all my bottles, remembered medicine, and to make sure I was looking at my daily weights, which I didn't really do that before. So making sure I woke up in enough time to take medicines, do my daily weights before work, plan out my meal for lunch so that the salt content was safe. It was a struggle because I was not, I would do a lean cuisine or something and I would keep it moving. And then when I went through this, that's when I learned how much salt is in lean cuisines.
Yes.
And so it was like, wow, okay, I'm cutting the calories, but all of this salt. So, even that perspective of me being able to educate patients and tell them, okay, well, just because it looks healthy for this, it's not necessarily healthy for this. So it took that whole eating journey on a whole nother level for me. Even with dealing with that with my heart patients. So it was a roller coaster ride of emotions and having to face my own mortality and being okay with not being able to do what I used to do, but remembering if I don't do the right things now, I'm not going to get to where I want to be. And so that was my reminder.
I love that. I love that.
That was my reminder. I have to do the right things now. And thankfully it has paid off because now I'm able to run 3 miles. I'm able to, do things with my daughter, keep up with her, but if I had not done that the right way, who knows?
And what I love is a point you made that you had to kind of face your own mortality. And as a health professional, especially as the physician, I think a lot of our training kind of separates us from that, because our primary goal in at hand is take care of others. And a lot of times, we do kind of leave ourselves kind of falling back and not necessarily taking care of ourselves as we need to. So, with this diagnosis and then the treatment course and everything else that kind of led up to it, you kind of had to put that kind of right back front and center, or really next to it, because it actually kind of sounds like kind of side by side, because the patients really did it. They unfortunately they couldn't even take a back seat because you had to do what you had to do to take care of yourself, but really more importantly, take care of your patients as well.
Unfortunately, I did have good patients who, some of them knew I was out on medical leave and they asked. And for some of them, I did share, and they would make sure to tell my nurse, make sure she takes a break. So, it is that we as physicians particularly feel like, we have to be the one to take care, and we don't step back to remember that our patients even care about us, especially the good ones. And we have to be willing to have that can't do and have this many patients on my schedule. I still care about you and these things going on, and understanding, because they realize, they look at us and they're like, yeah, she is human. They are human too. And so, we do have to remind ourselves, can be wise if we're not setting that example when we're educating them. It's going to be hard for them to say, well, you didn't take time when you were doing XYZ and you told me to. So, that practice what you preach thing
Yes.
has really helped me with my accountability, with making sure that if I'm telling my patients this, that I'm also making sure that I'm practicing this. So.
I love it. And obviously, especially with what's kind of going on, you've added the title of author, right, to a very extensive resume. And I definitely wanted to kind of touch on, who Dr. Maxwell is as the leader, because your resume, your CV, it looks very good, right? And this is what I always tell medical students all the time, right? It's like, it's one thing to just kind of be a part of the organization, right? But like when you're thrust into leadership roles, which you seem to like, when you get into an organization, you're like, boom, I got to go up to the top. I got to sense of directions. I definitely want to talk a little bit about that. But like, now that as an author, right? Like what is that about? Like talk to us about that.
So even since I was young, growing up in the church, my parents there was the Easter speech, there was the Bible study drill team. There was always something that I was doing, some kind of public speaking, some kind of education, class president of my class every year of high school. So I was always thrust into leadership activities. I always enjoyed writing. A lot of my Easter speeches ended up being my own writings by the time I hit high school or middle school, instead of the ones the Sunday school teacher gave me, because I enjoyed writing. And so when I came across the Women in White Coats and learned about the opportunity to tell my story, it really appealed to me to further my writing, because really, with being the chief medical officer and doing a lot of things in medicine, the personal side of me, I hadn't really had time to do much with that a lot. Going through med school, you lose your life. Going through residency, you lose your life. Your focus is learning, hospital, patients and everything. And so it's been a while since I'd really taken some time to get back into writing and to that personal side of me. And I thought it was a great opportunity to be able to do that. And so I enrolled in the media course part of Women in White Coats to help hone my skills with public speaking, since that's something that I enjoy doing. And then part of that course also include more writing. And so it just opened doors of just really being able to get my story out there, because I knew that even going through the episode with the heart failure, it wasn't just to go through it, but it was learning lessons that I learned. And I wanted to be able to write that down and document it, and know that regardless of whether it's heart failure or some other major thing that's life, it's how you use it and how you build on it that matters the most.
Now, was there any, especially as obviously you were writing, you enjoyed writing, was it tough, like actually having to put down on paper everything that kind of went on? Was almost like a reliving type moment? Was it difficult, that right? Or was it more like a therapeutic? How would you kind of describe that process?
Well, the other part of my chapter, the way that chapter starts, called Matters of the Heart, actually starts with the loss of my mom. My mom had heart failure as well. She was actually diagnosed when she was 40, so still early, but much later than me. And writing that portion initially was painful because it was a reliving in a way that I had not relived that day that I lost her in a while. So having to go back through and remembering the details and putting the deeper, willing to being able to be open when people wanted to talk about it, it was ready for that. But I felt like it was a much needed part of the book. With that part, it was a rather painful thing, because that was actually, I was going to visit her for Mother's Day weekend. I was pregnant with my daughter at the time. My daughter's the first granddaughter. And so this was really going to be a special time for my mom and me celebrating one another as mothers. And on the way to the airport is when I found out she was sick. And when I landed, I found reliving that in the details that were needed for the book. That was painful, but yet it was still therapeutic because there were some things about that day that I hadn't thought about long. Even in that, helped me to be able to, for patients who have lost loved ones, to show even more sensitivity when I'm having those discussions, or when those things are coming up, or someone walks in and they tell me, yes, I lost my mom last month, or I lost my dad last month. It puts things on a different level for me in the way that I talk with them now. So it was painful, but it was still yet therapeutic, because I hadn't really shared it at that level. And so getting it out and not holding it in was definitely a therapeutic process.
Amazing. And I hope people especially obviously read every chapter, but of course your chapter, right? Because there's so much that goes into that aspect of loss. I know my father actually passed away when I was a first year going to, like, in fact, I think it was like the last week of first year. So like experiencing such a loss and that such a time, right, can change you. And it's such an interesting fact that I've seen that, just kind of just following the journey and just kind of seeing what you're doing. You are able to kind of take that and, take that loss, but really build upon it. And you probably don't even realize the amount of lives that you affected in such a positive way. Because a lot of times, especially while we're doing the changing, we don't really like keep track, because that's just, unfortunately, that's how physicians work. We don't really keep track of all of the lives we're changing. But I know, and it sounds like you're doing such an amazing job. So again, thank you for definitely, being able to kind of pour your heart out and be open. Because I know as authors, I know that's usually the most difficult step, right? Just really kind of being open to an audience, like you don't even know, like I don't even know who these people are, right? I don't know who's listening in the lunch learning community. I don't know who's going to be reading this book and going to read my chapter. But I know that if I'm not open, and then someone else who's reading, who's listening, is not going to be open with what they need to be open with as well too. So definitely appreciate being able to kind of put those words and put those emotions for us, so that we can kind of go in and know who really is Dr. Maxwell. So definitely appreciative of that. If you had one goal that you would want the reader to get when it's all said and done, right, about Dr. Maxwell, after they read and after they they follow you on the social media and all, like if you had what would be the one thing you want them to get from you?
Probably the one thing that I want people to get from me is learn from the journey, because we're all going to go through something at any point. I really thought when I lost my mom, that was probably the worst thing that could have ever happened to me. She was my phone call every evening on my way home from work. And then we talked on Saturday and Sunday. When I lost her, and then the way that I did, I thought possibly, okay, this is it. This is my big thing that's going to happen to me in life, and I need to learn from it. And, but things going forward are going to be, they're going to go up from here. And, lo and behold, 6 months later, the next year, I found myself in my own battle, with heart disease. And so it's just embrace even the negative, because there's good in it. And even though it hurts and it's painful, just know that if you look to figure out where's the positive and what you can gain and what you need to learn from it, you'll be all the more better for it, and you'll be able to find a peace with it. And it's a lot of times not obvious when you're first going through it, but being reflective about it, sharing with those who love you and support you, and letting them do that and letting them in, will help you to see what that good is. So, focusing on, looking for the positive and the good and learning something through it, because it would be it's disastrous to go through something bad and never learn something good.
Obviously, with everything on your plate, right? And of course I always ask, oh, so what's next, right? Because again, that's like I just don't see you kind of stopping, right? Like I've got the gist that like you probably got more planned on the horizon when it's all said and done. So like after the book and everything, like what's next for you? Like what do you have any like plans? Any thoughts of where you want to go, or right now you're just kind of in the moment? Talk to us.
Well, since you asked, I am actually in the process of opening my own direct primary care practice. I have enjoyed being on the employed side, and I am going to venture on the very scary side of being solo. One of the things that we discussed earlier was the problem with the disconnect of having your patients come in and you talk to them and then they go home and there's still a whole bunch of questions. And a lot of that is unfortunately the way that medicine is set up. I have 10 to 15 minutes with my patient and I have to get out because I've got the next patient waiting. And I don't have enough time to go through all of that education information, all of those lifestyle things to make those things work that I'm telling them that they need to do to get their diabetes under control, that I'm telling them to do if they need to figure out how to make the life vest work and they're frustrated with having it on. I don't have the time for that a lot of times because of the way that it's set up. So I've made the decision that I am going to do direct primary care where I can offer 30 to 60-minute visits with my patient and provide them more quality time with me about what those things are that they can do to change their lifestyle and be able to maintain that lifestyle. So that's my next venture, because that is where I started when I was 14. That is where I saw myself as a physician, and I have made do with what I've had these last 10 years. But now I feel like I'm at a point that I really need to get back to the heart of medicine of where I saw myself as practicing. And so I decided I'm going to do my own practice so that I can bring that into fruition.
Oh, I love it. And those who obviously Lunch Learning community knows, I've always been a fan of the physician entrepreneur who wants to step out. And she, Dr. Maxwell, is 100% correct that, as a physician, we want to talk to you guys more, right? We want to give you all the time in the world, but the reality does not allow that. Right. The reality doesn't allow us to have 30 minutes for every single patient because it just isn't unless we take it into our own hands. And, I have a few of my friends as well, too, who are in the direct primary care who are going that direction because they realize that they're not going to be 100% fulfilled in what they're doing. Not to say they don't love what they're doing, but the confines of what they're doing it in just isn't successful for them, right? Mentally, spiritually, like it just isn't. So they're like, I got to break out. I got to do my own. So we're definitely going to wish you all of the best of luck. Where can people find you, follow you to kind of like, so especially the people, is it going to be in South Carolina or is it same South Carolina?
Right? South Carolina, yes.
So where can people find you to follow you so they know that when it's ready, whenever you're ready, they can sign up and go? Like give them all of the details, website, social, whatever that thing is, so we know we can track you down.
So my website is in the making, but I can be found on Facebook, Dr. Crystal Maxwell. Simple search will bring me up. Just Dr. Crystal Maxwell will bring you up to my Facebook page. And then from there, this week, I'm actually launching a link will be on that Facebook page with an enrollment link, or request for more information.
Nice. And member Lunch Learning community members, if you're listening to this, all of the information, her link will definitely be in the show notes, so you'll be able to click and go right to her Facebook page. Again, Dr. Maxwell, it's, first of all, thank you for obviously taking the leap, right, becoming an author, right, but obviously being able to kind of open up your story here on the podcast community, because like I said, we have so many people, we have physicians, healthcare workers, people who want to be healthier, right, who listen to this, and I know they're going to be, they're going to be taken aback, but they're going to be more driven, right, with your story, right? Because again, I think a lot of times as a physician, we don't, sometimes our patients, don't necessarily see us as, people as well. So they don't realize like, hey, I may be dealing with some of the same medical related issues that you may be able to deal with as well. So, thank you for opening up and, giving us that opportunity, to be motivated and to be driven and understand that, like, yes, it can be done, because clearly there's people in front of me who got a world of things to do, who are doing it as well. So again, thank you for that.
My pleasure. Thank you.
Thank you for coming to the end of the episode. It is yours truly, Dr. Barry Pierre. I want to give my undying thanks to you for your support. Just getting to the end of the episode means that you at least enjoyed today's episode. Hope you were empowered by today's episode. Please remember to share this episode with at least 2 people that you know that would be greatly affected if they did not listen to today's episode. And if you have not already done so, subscribe to the podcast. Leave us a 5-star review, especially on Apple Podcasts or wherever you can leave a review. Leave a review there, because your support is so valuable for what we're doing here on the Lunch Learn and everything with PR Medical Consulting. And if you have not done so, go ahead and join the listserv. To join the listserv is very easy. Just grab your phone right now. I'll pause. Join the listserv. You want to text Lunch Learn Pod. This is all going to be one word, Lunch Learn Pod, to 44222. And you'll be on the listserv. You'll know exactly when new episodes are coming out. You'll know about new episodes before they actually come out, because I usually tell my listserv members, hey, this is what I'm working on. These are the guests that you should expect to hear for the week on. Thank you, guys. You have a blessed day, and I'm going to see you guys next week.